When I was out for long walks, walking for a really long time, I noticed that I kept needing to sit down. And my husband asked, "What's the matter? Why can't you keep going?" And I said, "I've got this strange feeling. I didn't really know what to make of it."
There's not a lot of awareness among women about coronary artery disease. In women, coronary artery disease is a very particular condition. That doesn't follow the textbook description. They also report symptoms that aren't recognized by doctors or that are misinterpreted. And when it comes to the classic signs of angina pectoris, women more often present with symptoms such as back pain, fatigue, exhaustion, or restlessness. This leads to later diagnoses, delayed presentation at the hospital, and more severe heart attacks.
It woke me up in the night, intense pain and a feeling of tightness in my chest. I was having real difficulty breathing. I didn't want to call an ambulance. I didn't want to cause any panic. So I took the subway to the hospital. My instinct was that something just wasn't right.
And then she came to me and explained that she was feeling unusually restless. In Mira's case, she had not only a family history, but also the lifestyle. The high-risk lifestyle, smoking, excess weight, and stress. So I said to her, "Let's do some tests." She came in, we ran some lab tests, and an ECG. Everything was normal. Then, given the combination of her risk factors, I said, "Let's do a coronary CT scan anyway."
This is precisely where non-invasive imaging is an extremely important tool, because it can be used to rule out a cardiovascular cause very effectively in many patients. Or, as was the case with our patient, to clearly show the exact cause of her symptoms. The key finding in the case of our patient was that we identified a non-calcified, high-grade stenosis in the right coronary artery. This non-calcified narrowing of the vessel has a greater risk of rupturing and of then potentially causing a heart attack. For this reason, the patient was treated in the cath lab shortly after the CT scan and received a stent implant.
Treating women is tricky due to their build and also the size of their vessels. There's a greater risk of complications, of bleeding, and of thrombosis. In all disciplines involving percutaneous intervention, women are known to suffer from more complications more frequently.
When I got the diagnosis, it was a real shock. I'm doing very well following my treatment, but the fear is always there. I'd advise women with a family history to have regular checks. As women, we need to pay attention to what our bodies are telling us.